Hi, this is Ria from Youth Navigate, and today we're thrilled to welcome Christa Steiner, the reigning Miss Constitution State and a candidate for Miss Connecticut, but more importantly, a passionate mental health advocate who has transformed a personal story into a mission of service. Christa is an educator, advocate, and mental health changemaker. Beyond the crown, Christa has used her platform to champion mental health awareness, LGBTQ+ visibility, and equitable access to community resources across Connecticut. Through her initiative, Out of the Dark, she is helping young people navigate conversations around mental health with clarity, courage, and compassion. Today, I'll be interviewing Krista about her own journey and about recovery resources. So let's dive straight into the interview. So, about your personal journey, could you tell us more about your journey to becoming a mental health advocate?
Of course, my journey is deeply rooted in my own experiences. I had been struggling on and off with my mental health for about 10 years since I was 14 years old, and I didn't quite know what was going on. I just knew that I felt different and I felt off. But in the process of being diagnosed, I got diagnosed with bipolar disorder and I immediately jump started into getting better and seeking recovery. And the process of seeking recovery, of going to an inpatient treatment center, of going to intensive outpatient or an IOP, getting medication or getting a psychiatrist, that process was incredibly like mystified. There was a lot of things that were not spoken about that I just frankly didn't have access to. And I thought, I'm an incredibly motivated individual. I have a lot of privilege. I have a lot of access to finances and support systems that are helping me. And this is still really hard. So I really feel for the folks who have less privilege than me. And that feeling is what spurred me to want to become an advocate, to make the process demystified, and to help those folks who have less than what I have.
Mhm. So you've spoken openly about your own mental health journey. So what was the turning point where your recovery shifted from something private to something you felt ready to speak about publicly?
I had been working at a job
Mhm.
here in Connecticut, and I had to discuss with them the fact that under the ADA, bipolar disorder is considered a disability. And I needed accommodations for my job, that when I was having an episode or having a flare or something of that sort, that I legally was entitled to reasonable accommodations to make my job better and to make it more effective for me while
Mhm.
still performing for the company. And they didn't really understand why, I look fine. I look like a normal person.
Mhm.
Frankly, I'm not in a wheelchair. So why am I saying I have a disability? And that was really the moment when I was like, oh my gosh, I need to do something to educate people, not only providing the resources for the folks who are struggling, but also to educate people who are not aware and do
Mhm.
not fully understand how these mental health disorders can severely impact folks who are living with them day to day.
Got it. Thank you for sharing your experience. And another question is, what do you think young people need most right now?
Regardless of whether you are in the mental health recovery community or you're in a different group entirely, we are really lacking third spaces. We used to have going out to like the park or going to the library, going out and hanging out with people at a coffee shop, and I see it more and more as I move through life today, that we are lacking those community spaces where outside of work and outside of home, we can find people who are our people. That is actually what I really love about the recovery community and the
Mhm.
mental health community, is that it is just that. It is a community. And I tell that to people who are struggling, especially young folks who are scared. You don't have to be alone. And whatever it is you're facing, it's going to be tough. It's going to be difficult for sure, but you don't have to be alone in doing it. And I
Mhm.
think that we can help use the recovery and the mental health space to create more communities with that ripple effect moving forward.
Got it. So, talking about the recovery resources, could you tell us more about your organization, Out of the Dark? What exactly is it and what does it mean to you?
Out of the Dark is a collective of organizations that are dedicated to providing accessible resources to young people throughout the state of Connecticut right now, but really looking at getting as far of a reach as we possibly can. So we have in Out of the Dark any type of resource that you could need. Do you need support for educators at school to help navigate their students? You know, I have an education association. Do you need truly just one-on-one in-person therapy? We have something for that too. We work with Mental Health Connecticut, we work with NAMI, we work with
Hmm.
tons of organizations that no matter what the resource you need, you can just come and ask.
Hmm.
And we have that resource available to you. And it is by no means an exhaustive list, but it is a place to start. And frankly, if I don't have it or we as an organization don't have that resource, we will work to find you the resource that you need because it shouldn't be tough. You're
Hmm.
already doing the hard thing of asking for help. And that's honestly the hardest thing that any person can do. So I feel very strongly that once you ask for help, that help should be provided.
The organization sounds amazing. So, for someone who suspects they might need help, like you said, but feels afraid to tell anyone, what is the very first step you would encourage them to take?
Mm-hmm. So I actually, when I give talks at schools,
Hmm.
again, I go in and I talk about mental health disorders and what it is, and I engage with students a lot who are asking what they need.
Hmm.
I actually encourage everybody to reach out to 988, which is the National Mental Health Suicide Hotline.
Hmm.
And even if you're not experiencing like a crisis situation, I personally have reached out to 988 and they have gotten me resources that have helped me to get to the point that I'm at today. And I think that it's really important for young people. I know that like we're all on our phones, we're all in this like world. There are some folks who I've heard that are reaching out to AI for therapy support.
Hmm.
And I understand that need, but I think it's really important to reach out to a resource that is a real person, that is
Hmm.
not a computer.
Yes.
988, you can text them and they will text you back, but it is a real person. And I think that that's really important.
Got it. So, what are some other recovery resources you wish more young people knew about?
I have to say that the number one thing that I've been noticing throughout the course of my advocacy
Hmm.
is communities. Like I spoke at the Join Rise Be Youth Leadership Conference, which brings together a lot of the organizations, honestly, that I work with. I was their keynote speaker. And that was the biggest change that I could see was that everybody got in a room together and I spoke, and then they had the opportunity to ask me questions. And we all just sat in this room and said, we all have problems. We all have something that we're experiencing. And that is the resource that I think people are missing. It is no secret that mental health care, it can be costly and it can be time consuming. You know, I can't make the healthcare system better,
Hmm.
but what I can say is that the most accessible resource that we have is one another. You can
I
even
mean,
go on, yeah, you can go on NAMI's website, you can go on Mental Health
mhm,
Connecticut's website, and you can type in like recovery or mental health support groups.
mhm.
And they have support groups that you can go on Zoom or you can go in person and you can just raise your hand and say, I'm having a hard time. And you will instantly have a community that will be there for you.
That sounds great. So those are really good recovery resources. And
Yeah.
in your view, continuing from the last question, what makes a mental health resource truly accessible?
The thing that makes a resource accessible is that any person, regardless of their race, their
Hmm.
gender, their sexual orientation, their finding partake in this resource.
Hmm.
So that is what I really strive to do is to collect resources in my organization at least, that do not have those barriers or have the least amount of barriers that anybody would come up against in contact. And I will say that every resource within my organization is either free or is sliding scale and does provide free access to support groups or educational materials for people. So that is what I really think makes it accessible, is that anybody, no matter who they are, where you come from, you deserve and have the right to access this care.
Mhm. So, from our conversation today, I think we're really reminded that vulnerability can also be a form of leadership. So, by sharing your
Mm.
story and like advocating for accessible recovery resources, you're, I think, reshaping what strength really looks like. So, not silence, but openness, like in being in a community and all that. So, thank you so much for the interview and thank you so much for your time.
Thank you so much, Maria. I appreciate it.